everyone, my name is May Nunez and I'm a licensed psychotherapist. I'm also the clinical director for Ketamine Health Centers. Here at Ketamine Health Centers, we provide ketamine infusion therapy to target what's known as treatment-resistant depression. But that's not the only thing that we can target. We also help patients that deal with post-traumatic stress disorder, obsessive-compulsive disorder, postpartum, and even bipolar. For pain, we're able to treat conditions that are neuropathic pain in nature. Some examples of that are fibromyalgia and CRPS. One of the things I'd like to address right off the bat is why ketamine infusion therapy is more effective and more safe than traditional mainstream treatment approaches for mental health. The first reason I'd like to talk about is the whole notion of oral medication and the fact that only 30% of the population respond. Even if they do respond, it's usually coupled with very negative side effects. I'm sure all of you have seen commercials or videos where they talk about an antidepressant and then they'll list you like 55 side effects that could come about with taking that one medication to target depression. It almost makes you feel like what's better, stay depressed or take these medications. When talking about ketamine infusion therapy, it targets a completely different neurotransmitter. When we normally take what's called an SSRI, which is an antidepressant, which is basically all we've had for the past 30 years in psychology, we're targeting the serotonin. Ketamine targets the glutamate neurotransmitter. The glutamate neurotransmitter is viewed as the umbrella or emotional hub for emotional regulation. One of the very beneficial components of ketamine infusion therapy is that we don't have to wait for the traditional 4 to 6 week wait period to know if it's going to work. It's also the highest efficacy in treatment. We're at 70 to 80% effective with our success rate. When you look at that versus 30% with oral medication, the numbers speak for itself. If I start talking about pain, it works on the pain receptors. It's able to wipe out those very heavily saturated pain receptors. When we talk about ketamine, most of you have heard it used in conversations where it could be labeled as Special K or horse tranquilizer. And yes, it is a substance that has been known to be abused in the clubs like many other substances, and it has been used in veterinarian offices for purposes of helping the animals feel tranquil and sedated. But when used the way that we use it with the scientific protocol that we have, there is no potential risk for abuse. But again, when you look at it for its intended use at ketamine, it's very effective, it's very fast acting, and it does serve the purpose to relieve mental health symptoms. If you or anybody that you know would like a free consultation with me to come in and ask me questions about ketamine or even tour the facility and see what it would be like to be here, please visit www.ketaminehealthcenters.com.